Okay, it says you can release your video order. Meeting is now streaming live. All right, we are live. Hello, everyone. So excited to be here. Jessica Frankel, I'm going to be moderating our panel today. Before I get started, I just wanted to take a moment to acknowledge the indigenous land that we're occupying. I'm talking to you from New Orleans, Louisiana. I'm on Choctaw, Chitimacha, and Homa land. The indigenous name for the city is Obancha. And I would love to encourage all of you, if you don't already know, to take a moment to check out native-land.ca, which is going to be put in the chat, to learn more about the land you're on. And we invite you to comment also and share that. It's so important that we take a moment to acknowledge this. So I also wanted to share, we're going to be posting resources and highlights from this conversation on social media using the hashtag summer combos. So you can follow the conversation on social media, hashtag summer combos. So I will introduce myself. My name is Jessica Frankel. I am the coalition coordinator for the Louisiana Coalition for Reproductive Freedom, or LCRF. LCRF is made up of incredible local, statewide, and national organizations working together to educate, organize, and build a movement to empower activists to ensure and secure reproductive health rights and justice for all Louisianans. It's an honor to be here today moderating this panel with incredible leaders from around the country. I'm so excited to hear from them. Excuse me. We are really excited also to partner with the Women Project on this series of panels this summer. That's going to be bringing together leaders from across the country to discuss groundbreaking programs and policies, lessons learned in our work to advance reproductive health rights and justice, and of course, share resources and ways to get involved. This is our first panel that we're kicking off the series with today about expanding access to contraception. Being able to become a parent or add to our families when we are ready is critical to improved health outcomes and financial stability, and essential to building healthy, empowered sex lives. Unfortunately, many people continue to face obstacles to contraception. Immigrants and low-income families face significant barriers, but advocates are working hard to do something about it, and you're going to hear from some of them today. Study after study shows decades-long racial, economic, and ethnic disparities in several areas of reproductive health, including contraceptive use and affordability. The same people failed by our systems of justice and capitalism are failed by our medical systems. Not surprising. Social and structural factors, such as fewer neighborhood health services, less insurance coverage, decreased access to educational and economic attainment, and even practitioner-level factors like racial bias and stereotyping contribute to a racial ethnic gap that the Center for Reproductive Rights has called a human rights issue, and many public health advocates see as a huge gap in programs and efforts to improve health that causes very real harm. This first panel in our summer series aims to share information as well as ways to make a difference on this critical issue of health, financial stability, and bodily autonomy and liberation. So let's get going. We'll kick off the panel with Diana Rhodes from Advocates for Youth, who will talk about specific barriers that young people face. So Diana, you can go ahead and introduce yourself.
Hi, everyone. Thank you so much for having me. It's so amazing to be on a panel with such fierce advocates doing really amazing work in the community. My name is Diana Thu-Thao Rhodes. I am the Vice President of Policy, Partnerships and Organizing at Advocates for Youth. And I use she, her pronouns. So yeah, I guess I can just get started talking a little bit about this topic when it comes to young people, and specifically the multitude of obstacles that young people face getting both information about contraceptives and also accessing care. So let's start with information, right? Which for many young people starts in a sex ed classroom, which is where information on contraceptives should be, right? You know, just to kind of get a landscape of what it even looks like across the country when it comes to sex education and information about contraceptives. A lot of sex ed law happens at the state level. So we've got 39 states which mandate some form of sex ed and HIV education. And most mandate that when provided, programs should meet some general requirements. And I'm using very vague language because that's what the laws say, right? For example, only 18 states require medical accuracy. Only 9 states require cultural competency or responsiveness, and that is free from bias. And 39 states plus DC require the provision of information on abstinence. And most of those, the abstinence is stressed beyond other issues, right, in the sex ed classroom. And specifically on contraception, 20 states in DC require provision of information on contraception. But if there's not a requirement for medical accuracy, who knows what's being taught or if failure rates are being emphasized over efficacy, right? So all of that to say is that there's a patchwork of policy and practice when it comes to sex ed policy and implementation in the country. And it differs by state, school district by school district, sometimes even classroom by classroom. Young people need honest and complete sex education that gives them the resources and tools they need to make healthy decisions about their reproductive and sexual health. And that includes medically accurate information about contraceptives. So if young people, K through 12, in their school years are receiving inconsistent information about contraception and receive sex ed that is fear-based and shame-based and reinforces stigma around sexuality, that also impacts their willingness and understanding of how to even access sexual health services, right? So if the foundation isn't there and there's so much fear and shame and stigma attached to that, even accessing birth control, contraceptives, or even sexual health services becomes a barrier, right? So questions of where can I get birth control? Do I need contraception for other health issues, right? Can I go to see a provider and that care will be confidential? Will my parents know? Will I be judged, right? These are very real barriers. And then we get on the structural barriers, right? That are put in place on access itself for young people. So those barriers include confidentiality in accessing those services, health insurance coverage. If they're on their parents' health insurance, are those explanation of benefits going to their parents? Is there any confidentiality in accessing or receiving any contraceptives or birth control? And that goes into age, right? If you're under the age of 18, are you even able to access care, and in what clinics, right? And we know what's happened with Title X in recent years, right? So there's so much more confusion on where can I even go, right? Cost and affordability, which was mentioned, and I think it's going to be mentioned later on. Transportation, are these clinics, if I can only go to a clinic, are they open after school hours? If I can't go to my local pharmacy without a prescription, right? All the barriers that exist for people over the age of 18 or adults, right, or older people are exacerbated when it comes to young people, and especially those under 18. And the foundation of information isn't there, then accessing the actual services itself and the devices itself is even more difficult and more increased barriers. I can pause there.
Yeah, everything you're saying rings true to my experience growing up with abstinence only sex education or abstinence preferred sex education. So it's still going on, y'all. So we have a lot of work to do. So could you talk a little more about what efforts there are right now to address all of the barriers that you just told us about?
Yeah. So, I'll start with, Advocates for Youth works with an amazing network of youth activists. And one of our campaigns that I think my fellow panelists are going to talk more in depth about is the Free the Pill campaign. And specifically with advocates, we have a Free the Pill Youth Council, which is the collaboration of Advocates for Youth and IBIS Reproductive Health, which is made up of youth activists from across the country who are working in their communities to bring birth control pills over the counter, covered by insurance and with no age restrictions. The Free the Pill Youth Council engages in a number of efforts across the country to educate and mobilize their peers and to help bring birth control over the counter, covered by insurance with no age restrictions. Because quite frankly, young people are tired of jumping through hoops to get contraception. Especially the contraception they need, and they're tired of not being trusted to make their own healthcare decisions. So one of the efforts that our youth activists in this youth council have been doing is the Free the Pill virtual store, which is very cool, and it was launched last month. Actually was an idea pre-COVID, which was to really, how do we envision what it's like for a young person to be able to access and be able to get the birth control they need affordably and easily. And so there was an idea to come up with a pop-up pharmacy, essentially. And so you can walk in and pick up your Diet Coke and your Cheetos and your sunblock for the summer, and then grab your birth control and check out and go on your way, right? Unfortunately, with COVID, in-person pop-up store didn't happen. And so, I mean, young people are just so amazing that what we did was able to create a virtual store, a VR experience for you to be able to log in and just walk through a pharmacy. And hopefully we can drop in the chat the link to it, because the VR experience is so very cool. You basically walk through, you get alerts on your iPhone about information about birth control. You can really just virtually walk through, grab a soda, grab what you need, grab your birth control off the pills, check out. There's even a bodega cat on the shelf that you can pet if you want, and go about your merry way. And, I think for young people, I think it's so amazing, one, to have this platform, but also to really see visually what this world looks like, right? We get so bogged down in the barriers and the obstacles and what we don't have, to really think about the future and what it could be like to just walk into your local CVS and be able to access, the birth control pills or whatever you need, and in an affordable and accessible way. So that is very cool, the Free the Pill Youth Council. And I think my colleagues are going to talk more about the wider campaign and the panel. But another effort, just to round that out, is recent federal legislation that was introduced also last month. It was a busy month. By Representatives Barbara Lee, Alma Adams, Senators Cory Booker, and Mazie Hirono, called the Real Education and Access for Healthy Youth Act, which would ensure federal funding for honest, medically accurate, inclusive, and complete sex education, as well as providing funding to support linkages to sexual health services for young people, specifically young people who are sexually active. So this is a robust bill that works towards ensuring that young people have the information they need, which includes information about contraception, and then also creating pathways to services that they need to be able to have STI testing, to be able to get a prescription for birth control if they need, right? And so this bill is really exciting because it really does hit those obstacles that we were just talking about, the obstacle of and barrier to access to information, complete medically accurate, not shame and fear-based information, as well as, if young people are sexually active, being able to link them to sexual health services in an easy and accessible way. And so we're really excited also to, with fellow sexual health and youth advocacy organizations, to really advocate and really move this bill forward, including getting more co-sponsors and really continuing the conversation around young people and sexual health education and information.
That's amazing what you shared about the virtual reality pharmacy. That's
very
so cool. I'm gonna have to check that out. Especially the bodega cat. I love that.
Yeah, that's the favorite on the staff, is bodega cat.
So last question for you is, what can people do to shift the conversation around young people's access, or what are actions that folks can take?
Yeah, so as far as shifting the conversation, when it comes to access to information and care around sexual health, education, and services, really it boils down to the stigma around young people and sexuality, right? Sexuality is a normal, natural part of adolescent development, and young people should be given the skills to protect themselves, plan their futures. So when sexuality is approached with silence and shame, when sexuality is faced with silence and shame and fear and stigma, young people face increased gender-based violence, increased risk of unintended pregnancy, STIs, unhealthy relationships, bullying, and discrimination against LGBT young people. And so really is having further conversations to remove that stigma, right? Young people are already doing this already. That's the other thing. And so as far as how folks can engage, young people are doing this. They're engaging their peers. They're educating their peers. They're creating really amazing content on social media. They're mobilizing their communities and their allies. And we need to uplift that. We need to uplift and center the voices of young people and the experiences of young people when it comes to their sexual health and access to contraception. So actions to engage, the Free the Pill Youth Council, go to the virtual store, pet the bodega cat, pick up your birth control, join the movement, right? My fellow panelists who are so amazing are doing such amazing work and really kind of engaging in that. And, for young people, see if if contraception is available at your student health center when you're on campus, right? And if it isn't, find out why. Have conversations with administrators, mobilize your peers on ensuring that where young people are at, they have access to the services they need, including contraception. And of course, call your representative to co-sponsor the Real Education and Access for Healthy Youth Act and further the conversation. But I think it all boils down to really furthering these conversations, removing the stigma around young people and sexuality, and really uplifting the voices, experiences, and amazing work that young people are already doing on this issue.
Thanks so much. So our next panelist just celebrated a huge win, leading a campaign to pass a bill to improve contraceptive access for undocumented and low-income people in Colorado. We're very excited to hear from Colorado Organization for Latina Opportunity and Reproductive Rights, Karla Gonzales Garcia.
Thank you, Jessica. Thank you, everyone here in the panel. All lovely faces. I miss you all so much, and hopefully one day I get to hug you again. So here in Colorado, we just celebrated yesterday, actually, 2 days ago, celebrated the passage of our bill SB 009, which pretty much creates a state program in Colorado under Medicaid for undocumented people to be able to access contraceptives, as well as like the giving of like 1 year supplies of contraceptives for anyone that is eligible under Medicaid. So this was, honestly, like in my head, this is going to be a 2-3 year campaign because all the things that we have been experiencing with the pandemic, then we had a budget, a crisis budget in every state in the country. But then with the rescue plan, we were able to kind of like organize within the legislative, have a legislative strategy so we can tap in our networks, our relationships, so we are able to then have the support that when money opened up in the state because of the money that was coming here from the rescue plan, so we would have some money to create this program because that was the biggest thing, to create an infrastructure in the state. So why we did this? Why? So here, I think that there are very similarities that our undocumented folks face in the country. Like, for example, obviously, we do not have access to healthcare, correct? Latinx folks, we do not have, unfortunately, a lot of times accessibility to care. A lot of times we lack of insurance. And for undocumented folks, it's even worse. Just in the state of Colorado, around 30% of immigrants do not have insurance. And then when you talk about people with proper documentation, then it's like higher the rate. And also to through the years, unfortunately in Colorado, people, Latinx folks, were actually like leaving Medicaid. And this is for after 5 years of the Trump administration creating, fears for our folks in mixed status families to access care. So even if families or people were eligible within mixed status families, people were afraid to access Medicaid or to access healthcare because they were afraid that that would like jeopardize their family member to have at some point their immigration status change. So all these things, unfortunately, had put a lot into our communities. It was hard to see a path, correct, during those years for our communities to access care, basic care, like for example, the ability to manage your body, to be able to like control your body, to be able to control your pregnancies, to plan your pregnancies, correct, or your family, or how many pregnancies you want to have. So, and here in Colorado, as many other rural places also in the United States, our undocumented folks also have other barriers like transportation. A lot of times in rural Colorado, a person has to drive for 2.5 hours in order to get to the closest clinic. And there is, like Diana was talking about, for example, Title 10. Actually, in Colorado, like many of those Title 10 clinics closed. And so we have what we call, or what is called, the Contraceptive Deserts. Around 300, I think it's around 10,000 people here in Colorado do not have access to any contraceptive because of like how isolated they are in their communities. And like when they do even like a more in-depth analysis, is around 300,000 people. So like for us, it was imperative to make sure that accessibility to contraceptive is for like at least in those small communities where there is a tiny little clinic working, because a lot of times like the Title 10 clinics are not in every county or like in every city or towns in the state. So those little communities that have that provide whose providers, you know, accept Medicaid, now they will be able to have that. So now people will be able to go to those clinics and access contraceptives. The other thing that we talk about is also language barrier. For a lot of our communities, and here in Colorado, most of our immigrant communities are Spanish speaker communities. And we still have the influx of African immigrants here in the state, in other areas in Denver, but is still mostly Spanish speaker communities, and there is no translators, there is no interpreters. So the fact that there is still like a lack of cultural competence and linguistic competence services, it is a huge barrier for our communities, correct? The other thing too, let's be honest, workers do not have like work policy places that allows them to take like a few hours off so they can pick up the contraceptives. So if we are talking about a rural community where you need to drive 2.5 hours and you work in a low-wage job that doesn't have the policies that allows you to leave for that day, so you can go for 5 hours to pick up your contraceptive and then come back, and if you don't have the money to get childcare in order to leave your other kids with a trusted person so you can go to take this trip after you had like found a person that could drive you 2.5 hours in order to get your contraceptive. So like we have to like think out of like our own privilege, even as immigrants. And something that I'm gonna be very honest here, because this is a conversation that we have to have with our communities, even among immigrants, even among undocumented immigrants, because a lot of times Denver how Denver centrism, you know, works here is that our undocumented folks, sometimes they can access to some clinics and some services, but doesn't happen in our rural communities. And there was some pushback from our undocumented communities living in urban areas about this bill. So it's like it's something that we have to be honest, and that we need to talk to our communities, because if we don't work and we don't have those honest conversations, how then we are going to talk, how we are going to achieve collective liberation when we are just thinking about what is going to be convenient for me but not for others that are in different circumstances. So those conversations has to happen even within our communities, and those are courage conversations that we have to start, because otherwise we are not doing the service of community, but we are just like perpetuating oppression within our own communities. So all the things, correct, within all these social political contexts, geographic like political context, correct? Because we are talking about rural communities around the country, you know, and so we were like, okay, we just need to start with infrastructure. So then, little by little, we can put more services to the goal, or with the goal that in a few years, we can have all the reproductive health services and more medical services that our communities need in order to thrive. Because even in the maternal mortality crisis happening, and how in Colorado, indigenous women are 4 times more likely to die during birth. So here in Colorado, like still, we are not doing enough. We have just recently, Elephant Circle, our Promising Elephant Circle, have passed an incredible package of like birth justice bills that was like, oh my gosh, incredible, and first in its kind, correct? And that is gonna help us to keep pushing the information on how contraceptives actually help also maternal care, maternal health. And we need to talk about those connections because people do not understand a lot of times. And when our undocumented community is having premature births here in Colorado, we need to talk about the accessibility to contraceptives so they can manage their pregnancies, so they are able to manage their bodies. So I think I'm gonna pause there. I've been talking a lot, so thank you.
Thank you. I wanted to I know y'all both had mentioned Title 10, so I just wanted to explain what that is for folks in the audience who might not be familiar. The Title 10 is a federal grant program that provides comprehensive and confidential family planning services and preventative health services. But as you heard, with different administrations, there's been blocks to this kind of program. So I really appreciate what you said about the fear that was spread, so much hate speech and fear that was spread by our previous administration, and how beyond all of the barriers to access, like language access, like being close enough to a clinic, like being able to get a time off work, then having that fear of being able to even access healthcare is such a deep problem. And we have a lot of work to do to make this country a place that is safe and welcoming and where folks can live with liberation. So I wanted to ask one more question. Could you share any lessons learned in terms of intentional and intersectional campaigns for contraceptive access?
Yeah, I guess like our biggest lesson here learned, I mean, it was incredible because even my policy manager was like, we did it. I was like, until the governor signs the bill, I wanted to see. I became a professional paranoid doing policy, y'all. So that's what policy making like teaches you, to be a professional paranoid. So one of the things is like, you know, when we started with this campaign, it was a messaging bill. Like to our closest partners, correct? This is a messaging bill. This is a multi-year strategy, 2-3 years. So we are gonna be very like, it's like, how is it, like a structure with our message. Because when you don't, one thing in policy making is that when you don't control the narrative, or when the narrative is deviated, you already have lost ground. So as we were touching upon an issue that unfortunately in Colorado is still very stigmatized, like immigration, you know, because people think that Colorado is a blue state. Oh my God, yeah, yo, no, oh no. In many layers in our state, we have to fight hard, and with everything that we have in order to like push the things that we need to push. So with all of that, correct? This is not just came up out of the blue. We have been like working for so many years in building relationships, educating legislators, building like very strong partnerships with our with our partner organizations that at some point, you know, we were like very isolated in the Repro coalition, and then later it was like 2 years ago, it was like, wait a second, this is not just about Repro. This is about the well-being of our communities as a whole. Why we are keeping this just as a Repro? So what we did was like taking that from the, like taking just like kind of like walk out from that box and like making sure that all our partners in the healthcare space in Colorado, like were part of this. And they were like, you know, they were like, oh yes, let's do this. So we work with like a big range of partners working in the healthcare area here in Colorado. Immigration, our partners were still the Colorado Immigrants Coalition that was incredible, like helping us, the Center for Health Progress that does immigration and healthcare, you know, like trying to like, we can't just like be in a little corner, in a little tunnel vision about what we are going to do. We need to create those those relationships with other partners, because at the end of the day, this is about healthcare, and we are still trying to separate things, and that is not okay, because that's not going to take us anywhere. And that's what we saw here, that when we were like strategic about creating those partnerships, very transformative partnerships, because we work with those folks for like last couple of years doing amazing things in the state for healthcare, then things start working out. We got over 50 organizations endorsing the bill here for our bill. We like literally had like weekly communications and education with legislators, with partner organizations. Like we were educating our community constantly. Like, and one of the things that also helped with this is that when we were talking, you know, when we were once again, like with the concept of this bill, we knew that, you know, Denver area, you know, like urban communities have access, some type of access, correct, of contraceptive, because it's just like more concentration of clinics here. So we were like, okay, this has to be like lead by those who do not have that type of access, meaning by rural community, impacted community members. And that's what we did. All our impacted, except one, but all our impacted community members that you know, undocumented folks were from rural communities, leading the narrative and the stories for this bill, because that was going to affect them the most directly, because instead of that driving 2.5 hours to get your contraceptive, so they could get it in their communities. So all of that, correct? Like messaging, like the narrative, centering them, like making sure that the messaging was there, making sure that the messaging was with values. Because a lot of times when, like, you know, like you have your lobbyists and your consultants, when they don't understand the issues, sometimes they are like, well, this is going to be a cost savings for the state. And I'm like, great, yes. However, this is about the well-being of community members. This is about their ability to be able to thrive economically, physically, for their families to be able to, like, when you manage your pregnancy, then you'll be able to manage other things in your life and have other opportunities. So when things got tough about like what you're gonna center or what is the value that you're gonna lead, like with, you know, like pretty much I was like, no, we're not gonna do that. We are gonna be centering values and the narratives and experiences of our communities. While you think that that's gonna get like, that's gonna help with legislators, I don't care. What I care is about centering the narratives of our communities. Because when we don't do that, we lost the game. Because those stories are never, like, are almost never present in the policy making. It is all about when they are gonna win their seat, and they're gonna get reelected, who is gonna be with me, who like is gonna give me money for my reelection. And that happens in all like race and like skin colors, y'all. And that's the thing that we also need to start building here up, that like the intersectional analysis in the legislative, because there is none. So once, you know, like all of the things, like education, centering the message, the narratives, and being very, very, how you say, like, oh my gosh, I don't have the word in English, I'm sorry, but kind of like very structured and very like, yeah, this is where I'm gonna be this, strategic, correct? This is where I'm gonna be this. Okay, this is happening. No, now you do this, you do this, you do this, you know? Even if it was a messaging bill, I didn't care. We are still gonna like push it like it's gonna pass this year, and it happened. So it became the top priority for the Senate, for the Democratic Women's Caucus, and one of the priorities for the Latino Caucus. So yeah, and that's what happens.
Congratulations. And it's so important what you said about the importance of intersectional partnerships and working cross-sector strategically. And like you said, policy work will make you go crazy. I think we can all relate to that. So for our next speaker, we have exciting work happening in Rhode Island also, and we're going to hear from Brittany Fonteno from Planned Parenthood Southern New England, and we'll share more.
Hi, everyone. Good afternoon, good morning, wherever you are. My name is Brittany Fonteno. I use she, her, and AF pronouns, and I am the Chief External Affairs Officer at Planned Parenthood of Southern New England. We serve the states of Connecticut. Oh, I'm hearing that maybe I'm not loud enough. So can you all hear me now? Great. So we serve the states of Connecticut and Rhode Island, and today I'm here to talk about the campaign that we worked in coalition with partners from the Protect Our Care Coalition to codify the contraceptive benefit in Rhode Island. Jessica, do you want me to just dive in, or do you want to start with questions?
Sure. So how has access to contraception under the Affordable Care Act helped people in your state and around the country?
So this is such an important question, and I'm actually going to start off talking about around the country first and then zoom in on Rhode Island. So the Affordable Care Act, or the ACA, or Obamacare, so many different names that we can call it, has provided historic levels of healthcare coverage with fewer barriers in this country. Thanks to the ACA, 20 million people who were previously uninsured gained access to healthcare insurance. The ACA dramatically increased access to sexual and reproductive healthcare and saw the largest expansion in access to women's health in a generation. Thanks to the ACA, more than 60 million people now have access to birth control with no out-of-pocket fees. And I'm sure that many of you all know, and especially at our work at Planned Parenthood, barriers to care is something that really impacts people's lives and their health outcomes. And we know that cost is prohibitive for many of the healthcare procedures and services that we see at Planned Parenthood. And so the ACA really helped to make sure that we were expanding access and taking away one of the biggest barriers to care that people have. Thanks to the ACA, more than 60 million people have access to birth control now with no out-of-pocket fees. And the most important piece about this is that the ACA guarantees that private plans cover 18 methods of contraception. It's so important that people have the full access to contraceptive methods that have been approved by the FDA so that they can make the decisions about which method is best for their bodies, for their lives, and for their futures. I would just want to say that this is particularly important because 99% of sexually active women have used contraceptives at some point in time in their lives. And approximately 60% of women of reproductive age currently use at least one birth control method. And when we're talking about this, I don't really love to talk about it in terms of women's health. I think that that's really narrow. I think that it's important to expand it to talk about healthcare in general. Contraception is healthcare, and healthcare is something that people of all genders and different non-binary people can use as well. Myself as a queer woman who is married to a woman, we both use birth control, and it's because of health reasons. And any of the reasons that people have to use birth control, whether it is to prevent a pregnancy, to plan their pregnancies and space them, or for other health reasons, those are all valid. And so the ACA really helped to ensure that people have that control over their bodies and their lives without the barrier of cost. And so when we're talking about cost, what does that actually look like for people? The cost savings impact was immediate and dramatic. Nationally, women saved $1.4 billion on birth control pills alone in the year 2013. And so the ACA's birth control benefit went into effect, and contraception actually accounted for 30 to 44% of women's out-of-pocket healthcare costs. So this was something that made an immediate and dramatic impact on people's ability to be able to use that money for other really important things in their lives, whether it's other healthcare services, to put food on the table for their families, or to further their education, whatever they wanted to be able to use. We know that contraception should never be a reason that people can't afford other things in their lives. Narrowing down a little bit, now that we've sort of talked about the national landscape, in Rhode Island, at PPS&E, we have seen the tremendous benefit of the ACA. In 2012, the uninsured rate in Rhode Island was nearly 11%. In 2020, it had dropped to 4%. And what we know is that the decrease in terms of uninsured rates has had a tremendous impact on communities of color, particularly Black and Latinx communities. So the uninsured rate for people who identify as Black in Rhode Island has decreased from 16% in 2012. So looking at, the sort of general population at 11%, there was a higher rate of uninsurance in the Black community, and that actually dropped to 6% in 2020. So really amazing opportunity for Black people to be able to access the healthcare that we need. For the Hispanic and Latinx community, it dropped from 20% uninsured rate in 2012 to about 11% in 2020. Again, amazing, tremendous gains that have been made. I do want to say that even though that was incredible, 2020 did come along, as you all know, with the challenges of COVID, and we saw that steady trend in decline of uninsured rate actually ended up reversing. And that is probably not a surprise to many people who are listening here today. COVID-19 really devastated an already broken public health system, and it uncovered what we all know already existed in terms of the gaps, the disparities, the bias, and you see that in the outcomes of who was most impacted by COVID: Latinx, Black, Indigenous, and other people of color. And so sadly, the uninsured rate in Rhode Island, and particularly in Black and Latinx communities, did go back up. We are now in a situation where New England at large has had really good success with COVID vaccination, people making their own decisions of whether or not that is the right choice for them. And we are coming out of the most acute part of COVID-19. And so we're really hoping that we can get back to some of our really good work in coalition with partners to make sure that the uninsurance rate, that we can go back and reverse some of the damage that has been done and build a stronger, more equitable public health system in which people are insured and able to access the care that they need.
Thank you. And I know there's one of our panelists is going to have to leave at noon, so I want to give you a little time back, Brittany, but also wanted to be cognizant of everyone's time. Is that okay? Thank you so much. So we're going to come back to Brittany because we want to hear more from you about bills happening in Rhode Island and want to hear more about the SCOTUS decision. But I'm just going to shift over to hearing from Pearl from ReJAC, and then we'll come back to Brittany. Thanks so much. We're going to hear from Pearl Ricks in New Orleans from the Reproductive Justice Action Collective, a little bit about their program, Plan B NOLA.
Hello, everyone. I hope y'all are doing well. Hello to fellow panelists. Y'all are awesome. I've really been enjoying what you're sharing. My name is Pearl Ricks. My pronouns are they and them. I'm the Executive Director for the Reproductive Justice Action Collective. Some folks know us as ReJAC. And I want to talk about the program that we have. And I also want to touch on some of the things that were already shared that are in my notes, right? Because some of us have shared experiences and we're on different paths. So I'm really appreciating some of the things that are happening and that we're sharing. When we think about expanding contraception access, Karla and Diana, you both talked about stigma. And I think it's very important that we release the stigma of folks being able to do what they want with their bodies. And in releasing that, we also have an opportunity to understand what are some of the obstacles that they come across. So some of those obstacles, like were stated, are transportation, which is something that our Plan B NOLA program tries to help and cure, affordability, but also disinformation and a skewed narrative, right? So I want to put a light on gender and sex and how talking about contraception leads into what folks believe is for them, because not all women can get pregnant and not all pregnant people are women. So when we're thinking about contraception, when we're thinking about whether it's birth control, if we're thinking about EC or emergency contraception, if we're thinking about vasectomies and furthering research on what they call the male pill, but really is a pill that's geared towards controlling sperm versus controlling, ovarian release and whatnot, we can really broaden this conversation. I think welcome more people into it and be real with each other. So I wanted to take the space to honor that there are trans folks and non-binary folks and gender non-conforming folks that use an array of contraception, and that's perfect if that's what they choose for their bodies. And our goal here is to make sure that they have access to that. And something that I wanted to share in terms of information is a zine that ReJAC has. So this is our Plan B NOLA reproductive health zine. And in this zine, we talk gender neutral wise about like what is happening to our bodies, how does pregnancy happen, what are various forms of contraception. We have some community resources for the New Orleans area and a few other spaces in Louisiana. But that's available in English and Spanish and in Vietnamese, because those are the top 3 languages in our area, right? So creating the language, using it, and making sure that it's accessible to other communities, I think is really important. And when we talk about like what the community needs or wants, that supply to the demand of emergency contraception or any other form of contraception, disinformation is a big part of it. So some folks hear emergency contraception or Plan B and they think it's an abortion pill. So there are people that are really nervous to take this medicine because of that stigma and disinformation. And there are people that are not willing to dish it out. So ReJAC has Plan B NOLA, and Plan B NOLA is our emergency contraception program. It's run by donation or for completely free. And what happens is someone can text or call our health line. We do the New Orleans area. Sometimes we can get out to Slidell. It kind of depends because we're volunteer run. But they text or call our hotline. They get put in touch with a health line manager who's a volunteer, highlighting emphasis on getting involved in your community and loaning time if you have the privilege to do so. And then that volunteer fields some information, how long ago it was that they had sex, how many pills they want, because if they're over 150 pounds, a few studies say that you need to take 2 pills. So we offer an extra pill, and then what area they're in, as well as some other minor information. And that's passed on to a community support member, and we meet up with the folks that need emergency contraception. So multiple things are happening in that part of the program. We are providing a space to call. You can call or you can text us. It's a number that is accessible to our volunteers, and you'll get a response within, we have a 3-hour response time right now, which is like pretty great. But folks usually get in touch with us about 24, 48 hours after they've had a slip up or unprotected sex, whatever it may be. So folks are able to get in touch with us. They are able to trust us, and then we eliminate the transportation part. So if you don't have a car and you need us to meet you at the intersection of where you live, that's fine. We've had folks that are like, I'm with my family. They look down on that, but we're at the Walmart. So we've met people in the Walmart. Like we kind of meet people where they're at and just are like, what do you need? And when we link up with those folks, we provide them with an emergency contraception pack. And in that pack is the EC, whatever they requested, condoms in case they need it next time. Usually we can toss some lube in there, depending on what freebies we get. There is a pregnancy test to take 2 to 3 weeks after you take the EC to check its efficacy. And then people can turn to the zine I mentioned earlier, and they can write down, I took the pill on this day, so I need to take the test on this day. All right, you're finding out that you're not pregnant, great. Here are some other things that you can get involved in, or if you are pregnant, here are resources in the back for whatever decision you decide to make without falling prey to a pregnancy crisis center, right? So where are trusted spaces that will give you like gate-free information, like you don't need to be this far along or look like this type of person or need to pay this amount of money in order to understand what is happening with your body and some of the options that are available to you. So the relationship between community and the folks that are leaning on us is really important because of that confidentiality piece. And there was someone, I think it was Karla, that mentioned folks being separated and kind of being isolated. And I want to talk about another side of when you're isolated in rural areas, when your pharmacist knows your grandmother and knows your aunt and knows your cousin and knows your teacher, it's really not going to be comfortable for you to just go to the pharmacy, right? So Plan B NOLA assists people in being able to navigate that stigma, to be able to navigate transportation issues, and most importantly, I believe, navigating that cost. So we talked about it being by donation or free. Emergency contraception can cost folks anywhere between $40 and $100. And it's not like always readily available depending on what area you're in. They may tuck it behind the pharmacy counter. You may have to ask someone for it, even though it's over the counter. So when we consider the access that people have to getting EC and the affordability of it, having a program that can give it for free, or if you have $5, great. If you have $10, perfect. But this is where you can get it from. Another thing that I would like to highlight is, we talked about community needs, community wants. We talked about supporting and some of the ways that organizations are supporting. And also we need to consider what infrastructures, like the healthcare institutions that we have, that also make it so we have to move and operate in these ways. By the end of last year, we gave out 1,600 pills, and by March of this year, we had already met that. So we can expect that we're going to be giving out 4 times as more than we did last year. And with the election of 2020, we really started to see a spike in folks hoarding. And when we look at those actions and what folks have to do and go through to access that, we can tell that there's not enough supply for the demand, at least in a way that's truly accessible. So when we think about Catholic hospitals, we have folks that get out of the hospital and then contact us because Catholic hospitals won't write prescriptions for emergency contraception. That's a big issue. Like, we need to consider that. And then we need to consider what parts of our communities are taking on that weight and being able to leverage it, because it's a lot. It truly is a lot. We have coroner's offices calling us for donations because they handle stuff like that for entire parishes. Why is there not a budget? Why is there not a line item? And Karla, I'm so in love with some of the things that you've been talking about in terms of the funds are there, but are the values there? Like, that money is there. Those resources are there. The ability for us to partner across community to policy to legislative to whatever it is there, but are the values there to move it forward? So yes, I want folks to think about all of those things, and also to explore the intersections that people are talking about here, to explore the intersection of immigration and emergency contraception, or contraception in general, class, race, gender, explore that, and then become active in sewing together the gaps. You can volunteer, you can donate to organizations that are doing this work. You can share information freely without gatekeeping. Can you translate something? Fantastic, please do that, find a way. And for folks that need things, I really want to encourage you to push organizations like ReJAC and RJ organizations and criminal justice organizations, whatever it is, push us to show up in ways that matter for the community, because we are also better positioned as groups to support individuals. So how do we lean into that? And I feel like it's really important that we show up in ways that resonate with the folks that are around us. And then, lastly, show up for that policy stuff, you know what I mean? Make that rah-rah, because it's almost like that glass ceiling. We can change as much as we want at the grassroots, at the community level. And also, if there is a policy, if there is a dome, if there is something that prevents us from growing and reaching towards the liberation we're going for, we're going to hit against that every time. So I truly believe it's important that, just like this panel, we have a wide array of different folks that are coming to the table and discussing the things from their community, and that we take a minute to stand up and share, and we also take a minute to sit down and listen so we can understand how to help folks get contraception, whether it's emergency contraception. Through our partnership with Crescent Care, we can connect people with PrEP and long-term birth control. So what is it in the conversations we have that let us know how we can show up more? I'd like to leave y'all with rejacnola.org, which is our website for the entire organization. planbnola.com is our website for our emergency contraception by donation or free program. And you can also find the zine on both of those sites in English and in Spanish. It should be up in Vietnamese very shortly. And we have Can I Get an Abortion in Louisiana.com in case, the EC doesn't work. So, or you would like to share it with anyone, So thank you very much, Jessica, for ensuring that I can share this information with folks.
Thanks for telling us about these amazing innovative programs. I love the website, Can I Get an Abortion in Louisiana? Just so straightforward, and people have that question, and it's one place they could go for that information.
And one thing I would like to highlight, on the ReJAC website, either on the ReJAC website or the Plan B NOLA website, you'll find a toolkit. So what we did in the beginning of this is we wrote out every step of how we created this programming, because we found that other folks wanted EC networks. We can't tell you how to run yours from New Orleans, from Louisiana. Your community looks different, but we can tell you how we built ours, and then you can change it. So if you're interested in building an EC network, or you want to know what that looks like, you can click around on our site. We share information freely, and you can contact the info form if you're interested in starting one. We'll help you out.
Thanks, Pearl.
Yeah, thank you.
Brittany, I really appreciate your flexibility. Thank you so much for working with us so that we could make sure Pearl got to speak, and with the time constraints. So I'd like to come back to Brittany to hear more from Planned Parenthood of Southern New England about this exciting bill that you're working on in Rhode Island.
Yeah, thank you. Well, first of all, thank you, Pearl. It was really great to be able to hear all of the important information that you had to share. So I was happy to take a break and just put my listening ears back on. So now to talk a little bit about some of the work and what we're up to in Rhode Island. So there is legislation right now in the Rhode Island General Assembly that would actually codify the ACA's essential health benefits and consumer protections in state law. And so what that means is basically whatever happens on the federal level, and we all know that healthcare access is always under attack, especially the healthcare access that is most important to communities that are oppressed and have been minoritized. And so whatever happens at the federal level, in the state of Rhode Island, if we were to pass this legislation, these benefits would be protected for all Rhode Islanders. So this is incredibly important. What we have seen is that the ACA has survived multiple rounds of court challenges at the Supreme Court level, including 3 major cases, one that is very recent that I'll talk a little bit more about in just a moment. And so this year, we have been working very closely with our coalition partners in Protect Our Care and our champions in the State House. So Rhode Island Senate passed legislation that would codify the consumer protections of the ACA in state law, including the birth control benefit, which we know is wildly popular, not just in Rhode Island, but across the country. Specifically, the House has actually passed a bill for the past 5 years that has protected and would seek to codify the ACA consumer protections. What we need now is for the House to act. And so what we are seeing is that there are sort of two pathways forward. The first one would be that the House could pass the bill that the Senate has already passed this past February. The second path forward could be for the House to vote to pass House Bill 5441 for any of my Rhode Island people that are out there. This has already been heard by the Committee on Health and Human Services. So I want to just take a moment to really thank the champions that we have in the Senate that have been working for many years to make sure that they always hear this particular bill and that they always vote to pass it. And there's a couple of things that people can do now. One of the most important things is to really make your voice heard and ask the House Speaker to go ahead and move on this bill. That is something, an action that can be taken today. And I just want to say that we know that the birth control benefits that are afforded by the ACA are incredibly popular across the country. And the pandemic proved that we need more access to healthcare, not less. So this is one of the most important things that we can make a move on immediately. The time is now basically to protect access to contraception in Rhode Island state law.
Thank you for that. And, it's so important, folks, to get involved in your state legislature, because the bills that come out of state legislatures, they often get replicated in other states. And sometimes they go to the Supreme Court, like we're hearing about now. And actually wanted to ask you, Brittany, to tell us a little bit about what is happening on last week's decision from the Supreme Court and what that means for the Affordable Care Act.
That's really important. I just want to circle back really quick on your point about being active on the state level and in local politics. A lot of people, it's our national elections, they're really big, they're really splashy. People get involved in that, but then forget about so much of the important stuff that happens on the state level. And our opposition has not forgotten the state level, right? That is the long game that they've been playing. That is what we are seeing right now, is the end product of really decades of work that the opposition has put in, literally to, at the point of school boards, right? Like sex education, things like that. And so I just want to really lift up and emphasize the importance of being really involved in your community, in your local politics, and making sure that we're setting an example that can be replicated, rather than having to be at the point where now we are actually fighting against these national attacks and state level attacks that are coming over the country like a tidal wave, basically. So one of those attacks that we're talking about is the consistent attack on the ACA. Last week, we did have a decision that came down favorably from the Supreme Court. So we are, I would say, excited about the decision, obviously, but really concerned that this is something that is still being even litigated, right? So last year, the U.S. Supreme Court heard arguments in the case of California versus Texas. It's the third major court case of the Affordable Care Act. And so the case was brought by a number of Republican state attorneys general, and no surprise, backed by the Trump-Pence administration, despite the ACA's overwhelming popularity and the need to really work on expanding access to healthcare during a global pandemic. Surprisingly, in a 7-2 ruling, an overwhelming majority of the court dismissed the challenge and concluded that the plaintiffs had no standing. That was surprising because you all know that the Trump-Pence administration really did some damage when it came to the Supreme Court, and that we now have a very solidly leaning conservative majority on the Supreme Court. So I think that also just proves the power of the ACA and the benefit that it provides to people writ large. So the ACA has come under attack since it was passed in 2012. I'm sorry, in 2010. And more than 11 years later, it has survived these 3 major Supreme Court cases, and it has outlived a series of disastrous attempts to have the law repealed or substantially changed. We know that support for the ACA is at an all-time high nationwide. Most people, about 55% to be exact, according to a recent Kaiser poll, hold a favorable view of the law. And while politicians continue to attack our healthcare, the ACA remains the law of the land.
I'll never understand why it's controversial for people to have access to healthcare. It's so elemental. So everyone in the audience, I mean, this is the kind of things that we're fighting for. It's just basic access, and just there's more in addition to everything that Brittany talked about. There's even more. Change doesn't just happen with bills and laws. So we're also going to hear about some efforts, a critical long-term effort to shift and obtain the way people obtain birth control, from the hashtag Free the Pill campaign to make oral contraceptives over the counter. And it's important that we make sure people are counseled on all of their options and that their specific needs are met and respected. From the reproductive justice perspective, that also means ensuring that no one is coerced to use a specific method that does not fit their needs. It's not a one size fits all. And to ensure cultural competence, cultural humility for health providers, and address financial obstacles to getting or ceasing the use of contraceptive methods. We're going to hear from Monica Simpson from SisterSong to talk about their OC's OTC working group and the hashtag LARC Principles program. So Monica, please introduce yourself.
Hey, peace everybody. My name is Monica Simpson. She, her pronouns, and I'm the executive director here at SisterSong, coming in from Atlanta, Georgia. Today, Hotlanta, as we're also known as, and it definitely is hot here today and humid, but really, really excited to be on this panel and to have been in this conversation today. There's just so much amazing work going on all around the country, and this was just a reminder of just how connected we are and how necessary the work is. So thank you.
So can you talk to us about the importance of over-the-counter availability of birth control contraceptives, and how does that help to address health disparities?
For sure. So I'll start this conversation out by letting folks know that I am a person that was born and raised in the rural South, right? And so a lot of my experience and my coming into the understanding of reproductive justice is shaped by that, right? And understanding what access is and isn't, and why it's important and necessary for us to center the most marginalized, to center, you know, those communities that have historically been pushed to the margins. And so this need for an over-the-counter, you know, oral contraceptive is imperative, right, for our communities to be able to make their own decisions, to be able to determine their own futures, and for folks to be able to have access to all that they need, right, to be able to live their most fulfilled lives, right? Like that's really at the core of this. And this Free the Pill campaign has been a campaign that has been, you know, led by amazing reproductive health rights and justice advocates for quite a few years, that has been really advocating and pushing for us to have an oral contraceptive over the counter that is available to all, that doesn't have the age restrictions, that makes it available for everybody, right? Because again, I think it was Brittany who was talking about the impact of COVID and how this just really just, lifted the veil of what we already knew was happening. And so what we do know is that, communities of color, unfortunately, continue to suffer the most, right? And we know, like in states and areas and regions like the South, where Medicaid expansion is still not a reality for us, where we're still battling, for comprehensive sex education, like the ongoing fight for reproductive justice just continues to dovetail us into this conversation around the fact that we need more access, not less, right? At the end of the day, it's always about more and never about less. And so having access in this way, ensures again that those communities that need it the most will actually have access to it, right? And it's not something that we have to see as a barrier in our communities for folks to be able to have access to what they need. And so it's been really a joy to be a part of this OTC working group over the years, because I've learned so much from so many different communities, right? There's so many folks who are bringing from Native communities to Latinx communities, to our AAPI family, to Black folks, just really thinking about the ways in which this conversation shows up across all of our communities and cultures. And so to be able to have learned so much over these years about the ways that people talk about sex or not and our bodies, and what have been the roadblocks for folks in this conversation, the historical backdrop to this conversation has been really beautiful. And all of that was taken into consideration as we were thinking about moving this campaign to the forefront and pushing the Free the Pill campaign, out to the masses. And so I think that's one of the things that I've enjoyed the most about this work. And I think that's what makes this reproductive justice approach to over-the-counter oral contraceptives so important and necessary, because it is always about centering our stories, our communities, and what's most at stake for those folks who are people of color in this country.
So can you tell us a little bit more about the OTC working group and the Free the Pill campaign you're working on?
Yes, so it's really fun. So if you all have not gone to the website freethepill.com, I think it's .com. I'm always on it and I don't know what the end of it is. But it is an amazing site that gives you so many different resources on what the pill is, what this campaign is. But this has been a long-term campaign. This is not something that just happened overnight. This has included, activists at the table with researchers, with, healthcare providers, actually all coming together to think about what a more holistic approach to an over-the-counter oral contraceptive would be, right? And what it could be for our communities, and not led by pharma, not led by, a lot of the, players that usually come to the table in these conversations, but led by community and led by community experience and community need. And so that's what this is really about. And the Free the Pill campaign is the outwardly facing piece of this work that is really engaging community, educating community, and bringing more folks into the conversation and giving people an opportunity to find a way to advocate with us on this issue as we're moving this oral contraceptive over the counter. When we think about, what Pearl was just talking about with the EC work, that work, right, took many, many years, right, to get to a place where, emergency contraceptive was actually available over the counter. And so we're actually following in the footsteps of that work, to be quite honest, and thinking about, taking very intentional, very slow, very, again, community-centered steps about how we move this conversation forward. And EC has, again, given us a beautiful blueprint to be able to do that. And that's now what we're doing with the over-the-counter oral contraceptive group, as well as the Free the Pill campaign.
Exciting stuff. And just, we're all hearing about the importance of community-led work. That's something that's really coming through as a theme, and how the community needs to be at the driver of the work, and to share their experiences with legislators to really make an impact on, let them know what they need. So it's not coming from a top-down perspective, not coming from pharma or from, these folks who are just at the federal level. And you're, like Brittany said, the local politicians are so important too, because those are the ones who actually know the community and are in the community.
Yeah.
So I wanted to ask, as we're pushing for programs that fund access or help address different challenges, how would you like folks to know and consider about principle provision, and what are the LARC principles? Why did SisterSong and National Women's Health Network launch that initiative?
For sure. This is also a piece of work that I'm incredibly proud of, and it has had so much impact, more than what I think that we even anticipated it having. But we knew it was something. It was a conversation that needed to be had. And so when we think about access to contraception, we think about it again in the most holistic sense. Like we're not just zoning in on one particular method or advocating for one method over the other. It is about making sure that people have access to the information, education necessary to look at all of their options, right? Because this is about the human right to be able to self-determine, right? And so if we want to be able to self-determine, that then means that we have to have access to all of the options in front of us. And we should be able to then make our own educated decision on whatever that option is. And we should not have to be coerced or pushed or pressured into moving in one direction or the other. And that has just been something that communities of color have had to battle historically for decades, right? The ability to be able to make our own decisions, but to also have to push back against, very coercive practices and very harmful, violating, things that have happened, on the bodies, right, of Black and brown people in this country. And so for us, when we were, as we were in this conversation about contraception, and there was a huge push a few years ago, and in particular, right, when we think about this in terms of a timeline, where LARCs were like taking center stage, right? Long-acting reversible contraceptives, everyone was like, this is the holy grail. We are ready to go with it. And LARCs are amazing. Let me be the first person to say that. LARCs are necessary and a part of the plethora of options that people should have access to when being able to think about the contraception that they want to choose. However, again, if we think about history, if we think about this country, when we think about all of the things, right, in our bodies, right, to move towards one particular method over the other for us was bringing up some red flags, to be quite honest. And so SisterSong and our partners over at the National Women's Health Network came together to start to talk about those red flags. It's like we have an opportunity to insert, another narrative here for us to create what we like to call in our culture shift work, like cultural intervention, right? To help people understand the fullness of this conversation, not from the yay, we found the holy grail but how does this actually look, work, feel for community, right? And so we created the LARC principles with that as our foundation, that as our base, to help healthcare providers understand why it was important to center community, why it was important to center history in this conversation, why it was important to think as broadly as possible across orientation, gender, identity, all of the sorts, right, when thinking about LARCs. And it led to this statement of principles that was aimed at helping healthcare professionals take a more reproductive justice centered approach to thinking about LARC implementation. And from that, we asked for different healthcare providers to sign on to this, to take this into their work, to implement this in their work. And we got an overwhelming response. And the impact of that continues to grow. I think there's hundreds of different physicians, healthcare institutions that have signed on to this LARC statement of principles, and they continue to use it in their work today. And so that work, I think, continues to help us ground ourselves in this conversation around contraception that will continue to grow, right? As science grows, as the world grows, right? As we think about what's necessary for us to be able to have the reproductive freedom that we're all working so hard towards, that this particular LARC statement of principles help to really ground us in moving from a reproductive justice-centered approach.
Thank you so much, Monica.
Sure, yeah.
There's so much information, so much amazing information from all of y'all have shared today. We have a couple of minutes now for some questions and discussion. So I know there are comments coming in, and I'm going to be texted questions if there are any, but just want to give a moment for those questions to come in. Well, while we're waiting, one thing that I wanted to ask each of you is if there's one thing, okay, it seems like we don't have any questions right now, but what I will ask y'all, do you have any questions for each other before we close? No pressure. Okay. Well, we did want to give time for you all to share if there's a short action people can take or a resource that you wanted to give another plug for to keep people motivated and stay involved with your work. We can give a moment for that.
I would love to start off and then very curious to hear everyone else's actions that people can take. So if you're in Rhode Island, I have a couple of actions for you, and then I have actions that everyone, no matter where you live, can take. So if you're in Rhode Island, I would say, as I mentioned before, Planned Parenthood, we're a proud member of the Protect Our Healthcare Coalition, which is leading the fight to codify the consumer protections of the ACA. And so if you are interested in supporting this effort, you can follow the coalition on Facebook, on Twitter. You can also follow Planned Parenthood, PPS&E, at PPS&E, or at PPVRI. On Facebook, Twitter, Instagram, we have action alerts. We really try to make sure that we are involving the community every step of the way in this endeavor and all of the work that we do. And then when I'm thinking more broadly about actions that people can take, I have just a couple of things to share. We need to build upon the ACA, right? It is a good first step forward, but we need to continue expanding sexual and reproductive health care. And so we are encouraging people across the country to reach out and really make their voices heard to the Biden-Harris administration and to Congress, because we have work to do to end the Hyde and Helms amendments. We know that these are policies that are racist, outdated, and have no place in our world today. We need to overturn the Domestic Gag Rule. This is going back to the Title 10 conversation that a couple of people brought up earlier, making sure that Title 10 providers across the country, including Planned Parenthood, can continue to provide affordable birth control, preventive care, and other family planning options. We also need to make sure that we're continuing to select SRH champions for critical federal agencies and federal judgeships, right? This is not just, we can't have SRH siloed into certain places. We need SRH everywhere. We also need to address the maternal mortality crisis that is impacting women of color, particularly Black women, at staggering rates in this country. And then the final thing I will say is that we need to reckon with systemic racism, particularly anti-Black racism, injustice, and state-sanctioned violence in this country, with serious action-oriented steps that can move our society toward equity in healthcare and beyond.
Thank you, Brittany. Such a powerful call to action. And we have so much work to do to really fight for real equity and lift up those who are marginalized the most by our systems of structural oppression, and just appreciate everything that you have shared with us today.
I don't know what else to add to that. I think Brittany hit every single thing that we need to do, which is a blessing. I think that's great. The only thing I would add to this, it is, as a creative, I think it's really important for those of us who are organizers, cultural organizers in particular, artists, I live by the quote of Nina Simone that says it's an artist's duty to reflect the times. And we need as many people who across different mediums of art and culture work to really help to push new narratives and to open up new stories and to really help to create the foundation, kind of like to undergird this work that we are all, fighting for across all of our different states, all across this country. It really does take the artist's voice and the artist's eye, in my opinion, to help really illuminate what's happening in the world. And so it's my call out to all of my fellow creatives out there who are watching. And even sometimes in doing this work, I creativity kind of gets pushed to the bottom. I want to encourage you to unleash that and to bring that to the forefront, because it is the most revolutionary thing that we can do to create the world that we want to see. And I want to see liberation with all y'all in our lifetime. And I think that we're going to have to create that. So that's my call out to you all today and my call to action.
And with just a few minutes left, I do want to say just a final last words and a call to action as well. I echo everything my colleagues have said, and Brittany, you summed up so much. I was like, yes, and then that, and then that. So that was perfect. But just before I leave, I just want to, just remind folks that, young people are just tired of jumping through hoops to get the contraception they need. And they're tired of not being able to make their own healthcare decisions. And what we've, I think, learned from this panel and in this movement, that young people are fully capable of making their own medical decisions. And we have a responsibility to trust them to do so. I would say that the field and the movement can't afford to have young people out of the process of bringing birth control pills over the counter and expanding contraceptive access generally. So my call to action is to continue to uplift the voices and experiences of young people and ensure that the end result of all of that we're working for, every call to action, every part of this movement and all the work expanding access to contraception, that the end result of all of this work actually includes young people and that they're at the table from the beginning, middle, and end.
I guess to finish that up, all of that, and something that comes to my mind is like, even if you can't participate in one way or another, there is still ways, like, for example, talking to your family members and trying to have those courage conversations to destigmatize contraceptives, sexual ed, and just talking to your, asking, about sexuality, how our bodies work, just basic question. And if there is no answers, that way you can look for a way, and out to go and look for those answers, with the people that you trust, because it starts, a lot of times, that information with our parents. For young people, I mean, I remember my mom didn't have that information. I was like, okay, I'm gonna get that information then. And for parents too, if you have children, don't be scared. Those conversations, if you are not part of, let's see, you're still scared, because let's recognize a lot of our community members are scared to participate in the, to advocate for their needs in a political level, let's put it that way. You can do that at home as well by just having conversations. And that is radical. Don't forget that.
I love how you brought that all together, Karla. And we're all working to build the world we want to live in. I love that, what Monica said. So thank you so much to our panelists, and thank you to everyone who took the time to listen to us and who's going to get more involved in efforts to ensure and expand access to contraception. I know you're going to follow all the organizations. I know you're going to sign up for their emails and take action, and support them, donate if you're able. There's always work to do, but we know with all these amazing organizations that we will make a difference. Also, please follow my organization, Louisiana Coalition for Reproductive Freedom. We're at Louisiana Repro, and the Women Project, who's our partner on the series, where we have many more panels to come that we're very excited about. The next panel coming up is Info and Options in Crisis, Exposing and Pushing Back on Fake Clinics. It's going to be taking place at noon Eastern or 11 Central on July 7th. And this conversation is going to feature NARAL, Pro-Choice America, Repro Action, the National Women's Law Center, NARAL Pro-Choice Ohio, the Women's Center, and two from my coalition, Lift Louisiana and Hope Medical Group. Expanding access to contraception is good for health outcomes, and as we heard, it's healthcare. We need to address health disparities through providing healthcare and making it accessible. This will help improve financial stability for individuals and families, strengthen the economy, but most of all, it empowers people. It empowers our individuals, our community, and we really have to make a change in order to advance equity, justice, and liberation. So thank you so much for taking your time out of your day to fight with us, to close these gaps, expand access, and make sure everyone has all the options they need to manage their health, plan their bodies, and plan their families, excuse me, have bodily autonomy and control their futures with dignity and empowerment. Thank you.